Dr. Nardi here, and in this video we're going to talk about drugs. We're specifically going to talk about how drugs are addicting, even if they're legal drugs like caffeine. Look at Starbucks, giant business, everybody buys drugs there. We'll also talk about how when you do drugs, they can lead to feelings of reward in the brain, and we'll talk about what the biological underpinnings of the effects of drugs and how the drugs work in your brain. So stay tuned. Let's talk about drugs. And to talk about drugs, we're going to have to define our term. And at least for this video, we're going to refer to a drug as a medicine or a substance that's illicit or legal that enters the body and changes the body's functioning. Now, there are two classes of drugs. There's agonists and antagonists. Now, an agonist mimics or enhances the effect of a neurotransmitter. An agonist may occupy a receptor without activating it, so it blocks the neurotransmitter from binding to a receptor, or it decreases the availability of a neurotransmitter, again, by reducing the production or the release of it. So in this video, I just want to focus on psychoactive drugs, or drugs that have psychological effects, such as reducing anxiety or causing hallucinations, or changing your perception. And also we're going to talk about addiction, and we'll talk about how drugs can produce addiction. And some of that addiction is addicted to the sense of pleasure. And we will talk about what that looks like, so stay tuned. So addiction. Let's talk about it for a minute. That is just the preoccupation with obtaining a drug. It's also coupled with compulsive use of the drug, even with negative consequences. And there's a tendency to relapse after quitting. The other part of addiction is that withdrawal phase. Now, withdrawal is a negative reaction when drug use is stopped. So this could be negative physiological or psychological occurrences. So withdrawal is a negative reaction that occurs when drug use is stopped. You know, it often occurs due to the nervous system's adaptation to the drug. So withdrawal typically has the opposite effects to the drug. So if you think about some drugs that give you euphoria, like cocaine, then the opposite of that would be depression when you're not on cocaine. We also talk about dependence. Now, dependence is the need to keep taking a drug to avoid the physical and the psychological symptoms of withdrawal. Now, there are some distinctions to be made between physical dependence. So these are symptoms like headaches, difficulty breathing, and a racing heart rate, versus psychological dependence. The other thing I want to mention is addiction and dependency often occur separately, but each can occur without the other. So you could have a dependence on something but not be addicted to it, and you can have addiction to something but not be dependent on it. Other part that I want to talk about is tolerance. Now, tolerance is a state in which the individual becomes less responsive to the drug and requires an increasing amounts of the drug to produce the same results. Tolerance results from a decreased number or sensitivity of receptors. It also could be increased availability of enzymes to metabolize the drug, or increased reuptake of the drug. And now tolerance may contribute to overdose. Addicted individuals may take more of a drug to achieve its pleasurable effects and be overwhelmed by other physiological effects that the user had developed a tolerance to. So let's talk about some major classifications of drugs. We have opiates and opioids. Now, opiates, these are drugs derived from the opium poppy. They have different effects. One is they remove pain, they induce sleep. Opioids are not derived directly from opium, but may affect the same endogenous receptors. An example of an opioid is heroin. Another one is Oxycontin, and it has a particular reputation for being abused. And unfortunately, there's been an epidemic proportions in the United States to opium addiction, especially between 1997 and 2017. And heroin is the most notorious abused opiate, and we synthesize heroin from morphine. It was actually first synthesized in the late 1800s, and it was marketed over the counter in the early 1900s. It's actually 3 times more potent than morphine. Just so everybody knows, it's illegal in the United States, and it's strictly managed as a prescription in Great Britain and a few European countries. Another class of drugs is depressants, and these are drugs that reduce the central nervous system activity, and you will see effects of depressants in the sense that they will cause sedation, so they give a sense of calm. They also they reduce anxiety, and they also can cause sleepiness. The most common one that everybody's probably familiar with is alcohol, and it's probably the most widely abused depressant in the United States. And it's probably one of the oldest abused drugs in the world. And how you get alcohol is through fermented fruits, grains, and other plant products that contain sugar. And alcohol acts at many brain sites to produce euphoria. It reduces anxiety, sedation. It makes your motor skills worse, and it also impairs your cognitive ability. Alcohol also reduces glutamate activity, which is the most common excitatory neurotransmitter, and actually it actually increases the release of GABA, which is the most common inhibitory neurotransmitter. Other depressants are benzodiazepine and barbiturates. Interestingly enough, barbiturates were frequently used to treat insomnia and prevent seizures from about 1912 to 1960. And interestingly enough, they were not addictive in prescribed dosage. However, tolerance led individuals to increase dosage, which triggered addiction symptoms, such as those of alcoholism. Now, barbiturates act on GABA and can open chloride channels on their own in the absence of GABA. This means that there is a fine line between therapeutic and toxic levels of this drug. Now, benzodiazepines, drugs that act on benzodiazepine receptors on the GABA complex, produce anxiety reduction, sedation, and muscle relaxation. Now, benzodiazepines suppress the activity in the limbic system and moderate anxiety, agitation, and fear. Just as a note, these drugs are safer than barbiturates as they cannot open chloride channels on their own, but they are still addictive. Now, there are severe reactions to withdrawal from drugs, like, for example, delirium tremens. This is a severe reaction to alcohol withdrawal, resulting in hallucination, delusion, confusion, and in some extreme cases, seizures and possibly death. Now, stimulants, these are drugs that activate the central nervous system to produce an arousal, increased alertness, and elevated mood. They range from legal, caffeine, to illegal, like cocaine, and they vary in risk level. Now, cocaine is a drug extracted from South American coca plant, which produces the euphoria and decreases appetite. It increases alertness and relieves fatigue. There's also amphetamines. This is a group of synthetic drugs that produce euphoria and increase confidence and concentration. Nicotine is the primary psychoactive and addictive agent in tobacco. It's ingested by smoking, chewing, or inhaling. It actually activates the nicotinic acetylcholine receptors, producing a stimulating effect. Nicotine acts by activating the nicotinic acetylcholine receptors, producing a stimulating effect, which by the end of a single cigarette becomes relaxing and tranquilizing. Now, caffeine is the active ingredient in coffee and tea, which produces arousal, increased alertness, and decreased sleepiness. It's the most widely consumed psychoactive drug in the world. It's consumed by 85% of people in the United States. Then we could talk about psychedelic drugs. These are compounds that cause perceptual distortions in their users. They're believed to expand the senses and increase insights by the users. They're also called hallucinogenic, but more frequently cause perceptual distortions and feelings of ecstasy. There are serotonergic psychedelics that stimulate serotonin receptors to produce sensory distortions, repetitive geometric shapes, intense colors, and hallucinations. There's also catecholinergic drugs, and these drugs resemble both amphetamine and catecholamine neurotransmitters. So we're thinking epinephrine, norepinephrine, and dopamine, by the way, in case you're wondering. So they confer both amphetamine-like properties and psychedelic properties at once. MDMA fits into this category, peyote, those type of drugs. There's also NMDA receptor agonists developed as a safer surgical anesthetic, but were abandoned for producing distortions and hallucinations. And this actually looks like similar to schizophrenia, by the way. So marijuana is the next drug we're going to talk about. The major psychoactive ingredient is THC, and THC affects the cannabinoid receptors. They increase dopamine, which contributes to the mild euphoria and a sense of well-being, but actually chronic use diminishes the dopaminergic activity. People that use cannabis a lot have reduced volumes in their hippocampus and their amygdala, and they seem to have impaired white matter connectivity in the hippocampus and the corpus callosum. So let's talk about addiction. So it's hard to kind of fully account for addiction. Neither pleasurable effects from a drug nor withdrawal fully account for drug use motivation. We know there is reward there. So it's the positive effect of the drug has on a user. And the most implicated brain circuit is the Mesolimbic pathway. We call this a rewards circuit. And this includes the ventral tegmental area and the nucleus accumbens. Now, the ventral tegmental area is a structure in the midbrain, which is the source of dopaminergic neurons in the Mesolimbic pathway. So the nucleus accumbens is a target of the Mesolimbic pathway reward circuit. An addictive drug increases dopaminergic activity here. Some natural reinforcers with similar effects include food and water. Addiction creates a functional and structural change in the brain that persists long after someone stops using a drug. Now, there are systems in the brain that are part of that reward circuit, and these systems consist of the ventral tegmental area and the brain regions receiving its dopaminergic properties. This includes the nucleus accumbens, the prefrontal cortex, the amygdala, and the hippocampus. Interestingly enough, the other thing that adds to addiction is the reduction in activity in the frontal regions that controls working memory, behavioral inhibition, and the response to the environment. So this loss of this prefrontal cortex area kind of leads to more of that compulsive behavior. And with addiction, cravings persist years after you stop using the drug. Now, there are different treatment strategies depending on type of drug. There's agonist treatments, there's methadone, there's antagonist treatments, there's aversive treatments, and there's anti-drug vaccines. You will also see what we call comorbidity. And addiction often appears in a combination with a mental or emotional / personality disorder, which really complicates rehabilitation. There's also something I want to mention, which is the fact that there is genetics involved with addiction. We know that addictions can be passed on, like alcoholism can be passed on through generations. And there are certain genes that code for alcoholism. And these genetic influences affect how drugs are metabolized, how neurotransmitters and receptors levels work, and other addiction risk factors. And to be honest with you, this is a very, very complex subject, more complex than this video could ever touch on. So if you want to read more about it, I encourage you to search your local library or Google Scholar. But with that said, if you have any questions, leave a comment down below. And I'll see you in the next video. Take care. Bye for now.